Hi everybody, welcome back. This is Steve Cook. Today we're going to talk about hair transplant scars. On Dr. McGrath's McGrath Medical YouTube channel, there was a comment, a question from someone who was asking about repairing an FUE scar. The patient alluded to the fact that he was told that by using FUE and putting the FUE into the FUE scar, there was not going to be any scarring from the FUE. So, meaning that the procedure was going to be done where the head is shaved and the FUE grafts are taken out one at a time and they're placed into the FUE scar. Now, for the record, the FUE scar is not going to go away. It's just going to be better camouflaged because the entire area across the back of the head is a linear scar, and that area is not going to be taken out. It's just going to be filled in with little tiny grafts. So the FUE repair is going to be done using FUE grafts, and you're going to have scars from the FUE grafts. The viewer was asking the question because there may have been some miscommunication where he was under the understanding that there wasn't going to be any scarring from the FUE. So we thought we would take this video to explain to all potential patients out there that yes, you are going to have FUE scars. The strip or the FUE procedure, which is going back, the last 30 years or so, leaves a linear scar. Everybody knows that. And to some of the younger patients or some of the patients out there that want to wear their hair real short, they kind of rule themselves out where that's unacceptable and they choose FUE. So what the patient needs to understand is when we're taking out the grafts, you're going to have scars. Now, depending upon the type of skin you have is really what's going to determine how much scarring you're going to have or the size of the punch. There's a lot of variables. For instance, the Caucasian patients that have the whiter skin, they are going to have a smaller or require a smaller punch because their tissue is a little bit, I don't want to say weaker, but their hair follicles are a little bit smaller. So let's just say for this conversation, we're using a 0.8 punch. Whereas someone with a little darker skin, a little stronger skin, that can include, some European, Italian, Greek, definitely Middle Eastern, Spanish, African American, Asian, of a little bit stronger skin requiring a little larger punch. It's going to leave a little larger hole. It's definitely important to understand that when you are doing a FUE procedure, period, for this case, it's a repair of an FUE scar, you're going to have scars. So you might say, well, why would I do that? Why would I swap out one set of scars for another set of scars? Well, it may take anywhere from, on a small number, 200 grafts, on a large number, 350 grafts. It really depends on the size of the FUE scar, on how many FUE grafts are going to be needed to help camouflage. Of course, like any other part of the scalp, you can only put the grafts so close together. So the doctor is going to go in and he's going to move, let's just say, 300 FUE grafts. You're going to have 300 FUE scars in the back of your head, but 300 in the entire back of your head, and they should be spaced out accordingly because the doctor is an artist, and the artistry with FUE is to spread them out as much as possible, so you really can't pick up those scars side by side. So once again, FUE absolutely leaves scars. How big of a scar or how much scarring will really depend on your skin type. Also, your hair type, meaning very dark hair, for instance, Asian or Pacific Rim patients. They have a lot of dark hair, very white skin, and if they cut their hair too short in the back, even with FUE, your eye may be able to pick up the little dots that are kind of hidden in between the dark hair. The lighter the hair and the lighter the skin, the better the lack of contrast. Don't forget to like and subscribe to the McGrath Medical YouTube channel.